Why don't we get started since there's a lot to discuss, and officially we just have the hour. So thank you all for coming to our CAP meeting today. I want to thank Vivian, who in an offhand manner several months ago suggested a discussion on the nature of agency. Might be very interesting, and it just evolved into what we have today. So thank you all for putting the time in to put this together, and especially thank you, Mike, for chairing it. The title today is The Crisis of Agency in the 21st Century, and so Mike, you'd like to introduce the panel, and then we're off.
Okay. That'll be further off than normal. My name is Mike Green. And I'll just go ahead and let you introduce yourself.
Okay, I'm Rick Maddie. I teach anthropology.
I'm Simone, and I teach English.
I'm Vivian Jones, and I'm sort of a retired English teacher.
English emeritus.
That's it.
Mark Whitten, philosophy.
Trackey, biology.
Okay, so I'll go ahead and start. My role is twofold. One, to understand what agency was and is, and to define and introduce the other panelists. So I'm going to use the reading method.
Do you need me to hold it for you?
So that I don't necessarily say things that I shouldn't say. So, in reading about agency, after Vivian proposed this, I realized I knew nothing about it. And in reading about it, I realized there were many interpretations of agency, depending on one's background. So, I'll give you a short definition of agency. It's in email. But it then leads me to my form of agency. It includes the following dictionary definition: capacity, condition, or state of acting or exerting power. And then, or a person or thing through which power is exerted or an end is achieved. So it's both a representative process, it's an operation, and it's a physical or conceptual instrument for action. So, from my point of view, Bandura, social psychologist in 2006, identified a number of human agency factors, including intentionality, forethought, self-reactiveness, and self-reflectiveness. So, it can be within the individual as well as external. So I have a few thoughts, and I'll go to the others. First, such things I saw as agency would be something like federal law that have changed retirement planning. Retirement should be an individual decision, however that internal personal agency influences resulting from an external. So things like laws governing health insurance types, amounts, requirements, as well as rules regarding IRA withdrawal, taxes, Social Security offsets, all of those become agency. We also have sociological expectations influencing us in terms of when should we retire and whether we should do something after retirement. Yes, I'm trying to decide whether to retire or not, and now I'm realizing there's lots of influences. Second aspect, more psychological, involves the DSM-5, the American Psychiatric Association, is an example of agency influence on culture, Western culture. Once this list was published initially, and then later updated a number of times, it became part of the social and psychological awareness of mental disorder. And the issue is whether we agree with this group as a spokesperson for disorders or not. Third area might be that in general, technology, but from the area of psychology, technology and its influence in diagnosis and treatment of these disorders, particularly online apps that either function as a psychologist associate or in concert with the psychologist. One group of studies looked at the efficacy of computers as a therapist and suggested that in one aspect of the research, humans sometimes had a difficult time discerning whether it was a computer or a human. Just something to think about. I also found over 75 apps on iPhone and iPad for therapists to either completely do therapy, which is a little scary, or facilitate therapy. And then I just chanced on an online web parody by Lisa Kudrow called Web Therapy, where she plays Dr. Fiona Wallace. And it's all improvised, but she does mention that she can do therapy in 3 minutes on a web chat, and that avoids all of those annoying emotions. And just an aside, social networks have perhaps in some ways become an unintended therapy with internet-facilitated disinhibition. And the last one that I have is PowerPoints with textbooks, and how many PowerPoints have been developed to engage students, but use all of the aspects associated with death by PowerPoint. And there's many adjuncts and full-time use PowerPoint as an end rather than means. So, number. And I'll turn to the panel and see who leans forward first. Vivian, you started this.
Okay, I figured I would, that would be my favorite, right? Well, I do have some, I guess you could call them posters, that are kind of interesting, and they're just a single copy of each one. I'm gonna pass them around, and you can look at them and see if anything strikes your fancy. Just to give you an idea, this is a graphic which simply catalogs all the various companies that are involved in educational technology today. Educational technology obviously has become a very, very big business. The way that I come to the topic of agency is thinking about student agency, and I think in many respects we've been talking about and thinking about student agency all our lives as teachers. We care about what students learn, don't we? And we care about what they take with them. So this has prompted us as educators to use all kinds of jargon, terms like individualized learning, programmed instruction, mastery learning, just-in-time learning, differentiated instruction, inclusion, student success, student-centered, personalized learning, student engagement, student retention, adaptive learning, machine learning algorithms. All of these have to do with doing something that promotes a behavior that we want to engender in our students, which presumably is that they will act, that they will take responsibility for their learning, that they will figure out what they need to do at a given point, what they need to do when they're presented with a new task, what they need to do when they're confused, when they are preparing for a test perhaps, or when they're exploring even new frontiers in their careers outside of school. So a couple of months before I retired officially, I went to a conference at Rice University, not funded by the college, by the way, which happens every spring on personalized learning. And at that conference, March of 2013, I learned about how educational researchers have been studying virtual assistants, whether they are robots or sensors, or some other kind of algorithm to assist teachers and students in the learning process. So that got me going, so to speak, and I did come back and talk with various colleagues and did some reading. Now the rest of these I have about one per table. I'm not going to say something about every one of those comments, but I'm just kind of letting them out there for you to take a look at. And the first one is a block or slide about the new media consortium Horizon report. They partner with EDUCAUSE every year to produce a Horizon report that says, okay, in the short term, medium term, and long term, what innovations we expect to see. And what I found at the same time that I was learning about these virtual assistants is that learning analytics was becoming big, but it wasn't there yet. In fact, in 2013, it was still in the 2 to 3 year horizon. Now it's now. And that poster that I sent around with all of the colors, just about every company who approaches you today, every textbook person wants you to know that their product assists with adaptive learning, that their product has data, good data, to support it. And so data is really learning analytics. So learning analytics is now, what I thought was interesting in the 2014 report is there are 2 new things that may develop by 2019. One is the quantified self. Okay? Think about all of the data about you on the web. Okay? You're a quantified self now. And how might that be used in educational software for the good or the bad, I might add. And also virtual assistants, assistants. So something that functions, whether it functions as a, well, it's gonna function as a non-human, but hopefully we're all assisting in a human way. So when I think about learning agents now that we might see by 2019, I'm certainly thinking beyond clickers. We've gotten a lot of good data from clickers. You know, we know in the real moment whether our students are getting something that we just taught, but what aren't we getting? What potential is there out there for additional information that we could use as instructors to help our students learn and, you know, learn effectively? Some of those learning agents are going to be non-human. Non-humans don't comprehend ambiguity. They don't have common sense. So as humans, more importantly as faculty, I think that you know, we need to pay attention to what kinds of measurements are possible and what kinds of measurements are being made. Because ultimately, we want to have the kinds of measurements that will help students. So, as I mentioned, I went to Rice for this conference, and there's a fellow there named Richard Bereniuk who, in the late 90s, created or founded a group called Connections in Open Educational Resources. Now, I didn't know about him until then. I'd heard of Connections before that, but I hadn't heard about what they were doing with open resource textbooks. And I came back and shared, okay, there's a psychology book, there's a sociology book, and it's open educational resource. You can get it in the PDF, Well, now it's also an electronic book, and guess what? They are measuring how many clicks, they can measure, you know, the little tests inside the book, how the student responds to those kinds of things. So they're doing in a nonprofit sort of way what the textbook publishers have been presenting you in the last year or two. Their capability to do those kinds of things. So Rice is looking at those kinds of measurements by exploring student engagement with electronic textbooks. Skipping around one thing. Okay, I found myself. And I think when Simone speaks in a minute or two or five, a little bit about some of the important questions that rhetoricians ask themselves. These are starting off points for us as faculty, I believe, to assist technologists when they are coming up with the algorithms that will provide the data. You know, these algorithms, I mean, my goodness, I read well, I can't admit to having read all or listened to all 80 minutes of Andrew Ng's lecture on machine learning. In fact, in the first 8 minutes, there were 8 terms I'd never heard of before. So obviously, even though I see myself as almost as much a technologist as I do an English teacher, I don't have the knowledge to do the back work in the software. I do have the knowledge, the human knowledge of what makes sense between student and teacher. I don't have the time to be with each student face to face and get the data that I need to know what he or she needs. But I do have a good sense of what kinds of questions to ask. So I guess part of what I was really intrigued about is some of the stuff that I later was prompted to think of as the dangerous stuff. You may have seen the movie Her. And so, you know, there's a quote from a review of Her where Jason Farrago writes, "Her is the scariest movie of 2013. In Jones's all too plausible dystopia," he writes, "we are enslaved not by robots, not to robots, but corporations. And the invisibility, even desirability of that enslavement is what makes Her so chilling. In Jones's filmic vocabulary, China is shorthand for the future, and why shouldn't it be? A society such as the one in Her, in which even our emotions have been co-opted by corporate entities, is highly unlikely to be a democracy." When I read that, my response was, ouch, because that is the very thing 2 years ago, or a year ago, a year and a half ago, that I was the most intrigued about. I was the most intrigued about how a censor could convey the information that a student's brows were furrowed, and thus could discern that the student might be confused or bored or something. Not sure how they're gonna tease that out, but the point is, the research is being done. So I'd like to maybe come back to those questions after some of the other panelists have spoken. But, you know, be thinking about as you listen to others comment, what data needs to be measured or produced? For whom? Why? How? When? Who gets to turn off the data? Who has that power? Or who should have the power? Okay, who's next?
I'll go. Okay, I'll go. So I'm approaching it kind of almost purely from a Kenneth Burkean standpoint. Kenneth Burke is a rhetorician, in case you don't know, from the early 1900s. He wrote primarily between World War I and World War II. And my dissertation's on the Spanish Civil War, which also happened between World War I and World War II, so this just worked out perfectly for me. agency, when you look at it from through Kenneth Burke as a lens, is one part of his dramatistic pentad. The other parts, we've got act, scene, agent, agency, and purpose. And from a rhetorical standpoint, that really just looks like a rhetorical situation. So when I'm looking at it as a teacher, I tell them, every time you're trying to communicate, every time you're trying to argue something, I want you to place it within a rhetorical situation so that you can be effective. In a less Burkean point, we look at it from subject, occasion, audience, and purpose, right? Those are the four facets of the rhetorical situation. Burke, to me, makes sense. He makes me able to empower my students. He says that as humans, we are symbol-using, symbol-creating creatures, and that is our way of acting. That's what sets us apart from other creatures. And so the dramatistic pentad, he says, is a way for us to understand or sift through the communication to understand motives. So if you look through any kind of argument or any kind of communication throughout history, you can apply the dramatistic pentad in order to try to dig in and find out why they did it and why they were successful or unsuccessful. That's how I'm using it for the dissertation. I'm looking at Francisco Franco in Spain, and I'm saying, you know, he created an image for himself. He used this type of communication. The purpose was to become the leader of Spain for a very long time, which was successful. Also to appeal to international powers in a way saying, I'm capable, Spain's fine, don't interfere, we've got this all under control. And in doing so, he had the agency of power. He had an agency of support from the military, from religion, from all of these very powerful people in Spain. And so he created an image, he sent a message, he was successful, he stayed in power for 40 years. So that's my understanding of agency, is using this kind of power, this all of these things that you have at your disposal to enact change or to be successful in your communication. For me as a communicator, I love Kenneth Burke. I think he makes sense and he helps me make sense. And so subconsciously almost, I think I apply the pentad when I'm preparing a lesson for class, when I'm trying to help my students understand things. I think about my agency as an educator and the power that comes along with that and the responsibility that comes with that, and I see myself as an agent for change. My purpose is to educate, to prepare, to inspire my students, and I use this agency as an educator to help me achieve that. For them, I try to explain that their education can be their agency for change or for success. And so I try to help them become rhetoricians, to use rhetoric to act, to assert themselves, to be powerful. And sometimes it's successful, sometimes it's not successful. I feel, maybe in my naive state, that it is more successful than unsuccessful. But that's the idea here. For me, Kenneth Burke makes sense more than just the pentad, which agency is a major part of. He has two other theories that were in his Rhetoric of Motives. One is identification. And identification is a logical term. It's, you know, I identify with Cliff because we're both from south of downtown Houston. And so whenever he and I talk, I make sure that we relate to each other. We understand what I-45 South looks like. We know what Galveston County's like. We know what San Jack's like. And so I identify with them, and it helps me build a relationship. It helps build my ethos. It makes me a more credible communicator with them because we have that identification. But it's more than just identifying with him on a personal level. When I'm with my students, I need to find out what's important to them. I need to know all of these things, and I use his theory of identification to do that. He also calls this consubstantiation, which means that I can identify my own unique state while also identifying with my students. So I am the educator, I have all of these things at my disposal, but I also can relate to you for this reason, you for this reason, and you for this reason, which makes me a more understandable educator, which makes me a better rhetorician. I am consubstantiating with them. Okay, the other thing is terministic screens, which is my student's favorite term that we cover in class. And his theory of terministic screens is that my best analogy is from my cousin Minnie. One of the witnesses was debunked, and it was because, I just lost his name, Joe Pesci goes up and he says, I took a picture of your window, and you had the screen on there. What is all this stuff on there? And he said, well, that's dirt and bugs. And he goes, okay, so how can you see 50 feet away through this dirty, nasty screen? How can you for sure identify these two guys as the people who robbed the Sack and Suds and killed these people? And he realizes, well, he can't. And that's the analogy I use for my students. Your deterministic screen very much impacts the way that you see the world around you. So you have to clear off all of the crud and all of the bug guts and all of your experiences so that you can try to identify with other people, right? I've got my family's religion, I've got, you know, my economic background, I've got that I came from Dickinson, and I have to clear all of that way so that I can relate and identify with my Whitten students, and that I can relate to them on a personal level or an academic or a professional level. All of that said, again, I see this as just a method for empowerment. Okay, so I prefer to teach my classes from the point of view of rhetoric or visual rhetoric. I always tell my students, literature's great, and we can learn so much from literature, but if you use rhetoric, then the power's really with you. You know, you can interpret it, and as long as you establish your ethos and your credibility, and you can identify all of your evidence, and you can communicate clearly and effectively, then you're right. You've got that. That's power. And I always try to kind of approach it from a Burkean standpoint of how they can use communication and agency to empower them. As far as, I guess, to tie on to what Vivian was saying with technology, one way that I identify, and I think a lot of us do identify with our students, is on a technological technological standpoint. Jared and Michelle and Molly and I, we talk about this a lot in our meetings, that and you guys, I know I can't stop messing with my phone. But when you're with your phone, you have your students, they have their phones out, and this has been a big kind of, you know, it's been a big irritation for us that our students bring our phones out. I've ended up using this as a totally different way, and a lot of us have, where I say, hey, that phone that you just got out, instead of texting, why don't you use Google and look up the answer to the question that you just asked me? Or did you know that you can log on to my Lone Star and go into D2L and the assignment sheet is right there and you don't have to ask me that question? And so I've been identifying them and identifying with them and embracing some of this technology so that they can see all of this annoying technology as part of their agency, right? This is another thing that's empowering them. Molly and I were just talking about this, that right now I don't see there being a crisis so much. I think it actually, it's a crisis maybe for us as educators, because my students have a lot more ethos now on some level than they did a few years ago. I mean, they have the answers. It's like textbooks. The textbook companies are struggling because they're becoming obsolete. Because I can get all the answers right now. I don't need the textbook. I don't use textbooks for that reason. I can get the answers, so can my students. They don't need a textbook for that. And if there is a crisis, it's for that. It's that my students can get their ethos and they can have their phones as their agency immediately. So, you know, on some level, I think sometimes we try to struggle. We pull at straws to try to make ourselves feel more important or more relevant, you know, and that there's really no need. There's lots of things that we can offer our students that don't have to do with textbooks and the stuff that we kind of memorized from the books, right? We have to teach them how to apply it. We have all of our professional expertise, right, in the hospitals and stuff, that we can show them how they apply everything that we're teaching them. And that is also agency. So I don't have a really good way to wrap it up other than Kenneth Burke is great. And I also didn't hear his response. Yeah, Michelle's taping me.
We're all friends here.
It's pointed.
Okay. I've long been interested in the basic concept of an agent, the basic experience of agency, if such exists, and I think it does. So I've given a little handout in which there's a little brief, I guess I could call it phenomenological analysis of, I think, what's involved in the experience. First of all, will. The experience of I am able to make things happen. the power to make things happen. Will is an aspect of agency. Secondly, deliberation, the experience of I'm trying to decide what to make happen. And thirdly, the experience of choice, the experience of I am selecting what to make happen. I have the power to select among various alternatives what to make happen and what not to make happen. In other words, the experience at least appears to be one of making genuine choices among real alternatives. Well, the traditional word for that is free will. And how free will, if it exists, is a component of agency. And if we do have free will, in what sense do we have free will? Philosopher Richard Taylor several decades ago coined the term agent causation to try to make sense of this notion of free will, because admittedly there's something mysterious to it. It's almost like claiming to have a superpower to fly or X-ray vision or something like that. Difficult to understand in a scientific context. And Richard Taylor argued that there are actually two types of causes. There are physical causes, there's physical causation, and of course science studies those types of causes. But there's a second type of causation, agent causation. And that these are two different types of causes. They're two different types of explanation. You can't reduce one to the other. As tidy as we might like to make our world and fit everything into one, that fundamentally we have a dualism here, a diversity. Both can, of course, can be called into question. A lot of people assume that we have a very clear idea of what scientific causes are. And since we have this very clear idea of what science causes are, then we have problems with this murky, mysterious notion of agent causation. But if I remember correctly, Richard Taylor argues what we know better than any notion of physical causes is the experience of being an agent, of agent causation. And that actually this notion of physical causes is much more problematic among philosophers than might appear to be the case. And our understanding of physical causes is actually dependent upon our prior experience and understanding of what it is to be an agent. Of course, all of this is called into question by universal causal determinism, which challenges the notion of free will in this libertarian sense of genuine choices among real alternatives. So I've listed the three basic options. I present these to my students every semester. There's hard determinism, and you see the features there. I won't repeat them. What's known as compatibilism, or sometimes soft determinism, kind of trying to have your cake and eat it too. You affirm universal causal determinism, but at the same time you try to affirm we still have a legitimate sense of a free will and moral responsibility. And then the third option, which is the one, and I admit to my students in significant sense, I hope is true. I think it's possibly true. I'm not sure how I could demonstrate that it's correct. The notion of libertarian free will. But in terms of the issues for agency in the 21st century, I think there are three things that I see as fundamentally at stake here. First of all, the notion of rationality and truth. I think your understanding of rationality and truth, or whether you're even willing to talk the language of rationality and truth, is very much affected by your notions of agency, of free will, and this challenge of universal causal determinism. I have a few comments there that you can read at your leisure. Secondly, the idea of moral responsibility. Are we morally responsible? That's not saying things being causally responsible. I mean, I could have an unexpected epileptic seizure and strike Vivian here and break her jaw. I would be causally responsible for her injuries. Hopefully that won't happen. I would be causally responsible for her injuries. I would be civilly liable for her injuries. Big difference though if all of a sudden I just decide to sucker punch Vivian up here just to make a point. I would be criminally liable for assault and battery. And so we're not talking about causal responsibility. We're not talking about legal responsibility. We're talking about moral responsibility, which seems to be predicated on the idea that whatever one does, in some sense, to some degree, one could have done otherwise. I could have struck Vivian, sucker punched Vivian just a moment ago, but I chose not to. Okay. So again, I think it raises significant questions for moral responsibility. And then lastly, at least for some of us, the notion of human dignity. And I have a quotation from Robert Nozick here, who's a professor of philosophy at Harvard University. I will read that. Without free will, we seem diminished, merely the playthings of external forces. How then can we maintain an exalted view of ourselves? Determinism seems to undercut human dignity. It seems to undermine our value. And as Simone was speaking just a moment ago, I was kind of trying to connect with what she was saying with what I'm presenting here, and nothing I'm about to say contradicts anything that Simone said. But I heard the concept of purposes. I had actions. And I was raising the question, but actions by what standards? Actions for what purposes? Power by what standards? And power for what purposes? And so I think underlying these other expressions of agency and the particular ways in which we manifest agency, I think there's this fundamental issue of will, deliberation, choice. Do we have free will? Yes or no? If we do have free will, in what sense do we have free will? And how does that affect our understanding of rationality and truth, moral responsibility, and human dignity? But that's all, folks.
I'll go. Okay. When I was thinking about the topic of agency, I'm a medical anthropologist, and I studied physicians as a cultural group. And when you're talking about agency in American biomedicine, there's so many aspects of it that you could look at, and so I've tried to confine it to biomedical epistemology, the way that they know what they know, and the effect that digital technology is having on that today. Now, if you look at the way that physicians are trained, they're trained pretty much in the way that they initially were trained in 1892 in a model that was set down at Johns Hopkins University Medical School. That was the template for all American biomedical education. In 1911, there was a report that was done by the Carnegie Foundation about medical education in the United States and Canada. It was done by a graduate of Johns Hopkins University named Abraham Flexner. He was so familiar with that Hopkins model that he sort of interposed that on every other medical school that he looked at, and he used that as a standard to compare them to. So when he wrote the report, his criticisms were based on Johns Hopkins. And it became necessary for every medical school that was going to survive to come into alignment with the way that Hopkins did things. So that's consequently been the way that we have trained physicians. You have the first 2 years of medical school as didactic instruction, where it's mostly in the classroom, and they're learning anatomy and physiology and biology and the chemistry and the pharmacology that go along with becoming a physician. And then the last 2 years are on the wards of a hospital, seeing patients, following senior physicians around, learning how the first 2 years connect to a real live person. Now that has gone on for years and years and years, like I said, since 1892. And as our technology changes, the model has had to change slightly in order to adopt the new technology that goes along with it. But technology has been increasing much more rapidly than I think the original founders of Johns Hopkins would ever have anticipated. And we're getting to the point now where we have so much information that medical students have to learn, and so little time for them to learn it in. And the big question is what is absolutely necessary for them to learn, and what are some of the things that are nice to know and needful. And it becomes somewhat overwhelming. And we get to the point where I heard one medical educator say to a group of students, said 50% of everything that we teach you is wrong, we just don't know which 50%. And probably the best case in point I can give you is the treatment for peptic ulcer disease. Up before the early 1990s, we thought that peptic ulcer disease was caused by too much acid. A person produced too much hydrochloric acid. Well, there was this crazy Australian named Barry Marshall who started looking at the contents of the stomach of people who had peptic ulcer disease, and he noticed there was a little helical bacteria in all of these samples of stomach contents. And he wasn't the first one to have done that. Somebody named Guillermo Izozero also noticed it back in the 1890s, and another fellow noticed it back in the 1950s. We'd always had this idea that if you didn't make acid, you couldn't have an ulcer. But then we started finding anomalies where people were getting ulcers who couldn't make acid. They got them anyway. And so what was going on? Well, Barry Marshall looks at this bacteria, and he said this bacteria is weakening the stomach, and it's causing these lesions in the stomach. And to make a long story short, in 2006, he won the Nobel Prize for Medicine for discovering that peptic ulcer disease is caused by Helicobacter pylori, a bacteria. Totally changed the paradigm that we have. And so this is how rapidly things are happening. And the agency part of medicine, I think, comes in with the new technology that we're using in order to diagnose patients, to provide medical education, and to actually provide services for physicians. When we diagnose patients today, rather than medical students using their eyes, ears, sense of smell, sense of touch, they have a tendency to order tests first to use that as a diagnostic tool, instead of using the test as a confirmation of what they already learned with their five senses. And so that's a problem of agency. Digital technology in medical education, there have been some studies that have shown that if you are reading something digitally, that your retention level is much less than if you're reading it in an actual book and being taught that. A study that was done at Cornell showed that students in one class who were taking physical notes in their class did better than students who were taking notes on a laptop. They had more retention of the material when it was tested. And we're going to more and more digital resources in medical education today, and the question is, how much of that is going to be retained by the medical student? Are they going to remember it? Are they going to be able to remember it in an emergent situation where they have to know it? And then secondly, or thirdly, we have technology to the point now where we have robotic surgery. And you have a new machine called the Da Vinci surgical device that you can do all kinds of surgical procedures on, but it puts the question of agency in an entirely different context, because you have a patient laid out on a table with little trocars about the size of my little finger punctured through the abdominal cavity, and you have small fiber optic instruments that can move throughout the entire body to the point where you can actually do a cardiac bypass through the stomach. Because if you use the mammary artery up here to redirect the blood, it's only about a 6-hour procedure. The patient goes home after 2 days of observation, and there's no pain because you haven't cracked the chest. But the physician is not standing over that patient. The physician is not feeling the pressure of the scalpel go through the skin. The physician is 25 feet away under a hood with a joystick, and he doesn't see a patient. He sees through the viewer a set of constituent parts. Now the question is, does that change the doctor's view of the patient? Is that really a person, or is that a bunch of parts I have to fix? So tying all these things together, agency, as it applies to medicine, is kind of a two-edged sword, as all technology is. There are good parts to it and there are bad parts to it, and what we have to do, what medical educators have to do, I think, is wade through all of the information that we have and all of the peripheral distractions that we have in medical education, and determine what really are our important objectives and what are we trying to produce here. Digital and electronic media and devices, I think, should be employed if and only if these devices have been consistently demonstrated to improve outcomes in medicine. And I think if we're using technology, if we're using new ways of doing things, just because they're new, that doesn't necessarily make them good. I brought a quote from Peter Berger that I thought was particularly good, particularly applicable to this. He said, "We all exist within a variety of social networks or conversational fabrics, which are related in often complex and sometimes contradictory ways. When we get to the more sophisticated of these conceptions, there are likely to be organized practices designed to still doubts and prevent lapses of conviction. These sociologists have called legitimations. These explanations or legitimations are designed to convince people that what they're being told to do is not only the prudent thing, but also the only right and salutary one." And that's what we have to watch out for. We have to make sure that this is the right thing to do and not just something that seems right, but may have a higher cost for us to pay down the road.
Yeah, I was nervous.
This was like an introduction.
I was nervous, you know, I was nervous. I thought I'd be off in left field. Now I'm nervous because I'm gonna do the death by PowerPoint thing that Mike was talking about. But it's okay, I went through it last night, and I got it down to about 30 slides, so it should only take about 3 hours.
All right.
Perfect. I think I can sort of hit almost everything's talked about with this. And Vivian talked about uniqueness. People are unique, having these sort of specialized learning programs because of their uniqueness. And yes, we all are unique, and we're unique because we have different genetic makeups. We all know that. I just put this up here so we're all on the same page. So we all know we have DNA, it has genes on it. The sequence in the DNA determines what genes we have. We know that it creates the proteins we have. We don't have, that's what creates us. We can go back, we can find genes that lead to anxiety, depression, hyperactivity, learning, memory, all of these things. So cancer, depression, heart disease, that's where I used to work in that field. And it's a good thing, it's a bad thing, because this is sort of an agent in itself. What genes you have, what genes you don't have, who you can become, who you can't become, because you're limited by your genetic makeup. The good side is that because we are unique, we do have differences in our DNA. People who commit crimes, lots of times they don't get away with them, so we can catch them. If we could find genes that lead to depression, anxiety, hyperactivity, heart disease early enough, and we could change them, that's a good thing. That would be, to me, a good agency. We could actually do those things. We know we can do it to some degree because we can take genes out of organisms like the jellyfish here that fluoresces green because it has genes to create the protein that fluoresces green, and we can put them in things like mice and monkeys and frogs and make them fluoresce. That's just the beginning. What we're going to do with these fluorescent organisms. It's not really about that. It's about we can actually take that gene, if it was a good gene, and I'll let you decide what a good gene is, and possibly replace it with, replace the bad gene with that. That's a good thing. That'd be helpful, happy. Helpful, happy, great things don't sell as bad as the fear and horror. So let's talk about the fear and horror of this. I looked at agency at multiple levels, at the governmental level. So if I knew what your genetic makeup was, since it's unique to you, I could make some predictions about your behaviors possibly. Now, it's not all just environment, it's not all just biology, they work hand in hand, I understand that. But I could get some baseline sort of ideas of how you're gonna behave. Do you have genes that create high testosterone levels? You might be aggressive. Does that mean now we have to watch you, your behavior, limit what you can and can't do? We know that we have these specialized programs. Is it possible that someone's just not intelligent enough because they don't have intelligent genes, so we have to assist them somehow to survive in life? I put the list here. It seems like there's always a list, a terror list. If we know something about you ahead of time, we can put you on some sort of list and keep track of you and possibly control you. And that would be my concern with this. Because again, everyone's DNA is unique. Look at the school level, college level. Specialized programs. We have specialized programs here. High schools have specialized programs. People get put in those specialized programs because they're supposed to be a little different. They have reading, writing disabilities, they're dyslexic, they're hyperactive. We go back, we can find genes for all those that cause those. So if we knew the gene sequence or knew what genes you had ahead of time, does that mean the government or schools or people are going to put you in those programs and isolate you and force you to be there? That to me is a scary situation because I don't think it should be done to anybody. And that's sort of, I think, what you were talking about. And will they receive certain modifications or accommodations, or will they not get certain modifications, accommodations? We go to DSM-4. What becomes normal and abnormal? At what point? 51%. If you have 51% of the population has anxiety, then does that mean the other percentage is abnormal? Because now normal is having high anxiety. I don't know. There's going to be probably someone trying to make that decision for us. That's what I'm concerned about. Could they make that decision ahead of time before we're even born for us? What programs we go in, what we can do in life, what we can't do in life. Private businesses, insurance companies, you guys had to fill out Mike and I talked about this, had to fill out whether you're a smoker or non-smoker. What if they had your genetic makeup and they knew whether you're going to have heart disease or not? They may not want to insure you. Good luck getting insurance. We know that there's a high probability that you're going to have heart disease and die. We don't want to have to deal with that. So if we could fix it, then do you get to fix it? Probably the rich get to fix it, the poor might not get to fix it. So now what we have again is a division. We have these groups established based on how rich or poor they are. That to me is discrimination. We're heading in the wrong direction possibly. The insurance companies, I don't know if you guys saw this several years ago. There's a big company out there that behind the backs, they claim behind the backs of their employees, they were taking life insurance out on them. And if they died, they cashed in, they won money. That company got paid for because that person died. And so if a company knew that you had a chance of having heart disease or a high risk of suicide, could they be playing sort of a fantasy football league behind your back and making money off you where your family didn't get paid if something happened? People were not getting paid according to the claims of their family members. The company was making out. So as your company start taking out life insurance on you, with their employees. And then I think this is sort of at the self-level agency. I have those students come to me and say, you know what, I just don't get your science class because I have dyslexia, I have reading problems. I don't have good memory. So if I had the idea that I had the genes that lead to poor memory, does that then individual limit themselves on what they could or could not do? So, I think I hit almost everything. Simone talked about this, sort of seeing things the way they are. If you start classifying people like this, they don't really see how it really is. They see what other people want them to do. And then if they do it themselves, that's a huge, huge loss. So I think I saw the agency at multiple levels here.
Along those lines, one of the things that I thought about, having worked in the pharmaceutical industry for a long time, when you interviewed someone for a job, now we have the technology, we could call somebody in for an interview and say, have a Coke. And he drinks a Coke and you interview him. And you keep the Coke can. And after he leaves, you sequence his genome. And you find out he's got the gene for prostate cancer. They'll say, we just won't interview him again, he'll never know.
Absolutely. That's not a good thing. Or maybe it's a good thing, who knows, depends on how you look at it.
Well, first, let's give everyone a hand. Thank you.